Welcome guys. So today we'll be starting with a new topic that is called as sleep and EEG. Okay. So often in exam we get confused with this term EEG and ECG. Okay, this is electrocardiogram and this is called as electroencephalogram. Now this electroencephalogram, it represents the overall activity. Which activity? We call it as electrical activity, overall electrical activity in the brain. And this electrical activity, it is mainly in the form of summated potential. Summated potential, very important. Fine. Okay. Now this summated potential or the overall activity of the brain, it is something depending upon the frequency. Now what do you mean by frequency? Yes, number of waves per second, right? And this frequency is directly proportional to the electrical activity of the brain. That's it. This is the introduction about EEG. Fine. Now if we move on further, in the brain we have 5 different waves. Okay, the first important wave is something gamma waves. Now this gamma waves is having a frequency, okay, of more than 60 hertz. Gamma waves is having more than 60 hertz. And then we are having something called as beta waves. This beta waves is something 13 to 30 hertz. Fine. Okay, this is about beta waves. And then we are having here the beta wave, that is 13 to 30 hertz. And then we are having alpha waves, which is 8 to 13 hertz. Okay, this is about beta, alpha and theta wave, which is 4 to 7 hertz, and the most last one, that is delta wave, which is 0.5 to 4 hertz. Now in this thing, our gamma waves is having the highest frequency. Yes, which is having the highest frequency, the gamma waves, and at the same time which is having the lowest frequency, that is our delta waves, lowest frequency. That's it. Fine. Okay, so this is about the gamma waves and the delta waves. Fine. Now let us move on further and talk more about the waves of ECG. Okay, so this is your 5-mark question. Okay, that is the waves of EEG. So first we'll be discussing about the alpha wave. Okay, so the alpha wave, it is seen when the eyes are closed. Okay, so it is seen when the eyes are closed. Okay, that is in non-sleeping person. Okay, eyes are closed, but in non-sleeping person, that is only during the relaxed state. Okay, relaxed state. So the person will be inattentive. Yes, will not be fully focused, but the person will be inattentive, and we know the frequency is about 8 to 12 hertz. That's it. The most important thing is it is seen when the eyes are closed. That is mainly with the non-sleeping person, so it becomes inattentive stage, right? Okay, now this is generally maintained from the occipital and parietal cortex. Fine, very simple. Okay, now this is about the alpha waves, and then we'll be moving on with beta waves. See, beta waves is very simple. It is basically a wave of attention. That's it, wave of attention. The frequency is about 13 to 30 hertz. Okay, it is mainly generated from the frontal cortex. Okay, frontal cortex, or also from the PFC, that is prefrontal cortex. Prefrontal cortex. That's it. So only 2 points. Only that is the wave of attention. The frequency is 13 to 30 hertz and is mainly from the frontal cortex or the prefrontal cortex. Yes. Next we'll be moving on with the theta waves. Okay. So this theta waves is very important because now in theta waves it is mainly generated from hippocampus. Okay. So it is generated from the hippocampus. So you all know that the hippocampus is for the conversion of short-term memory into long-term memory. Okay, so it is generated for the conversion of short-term memory to long-term memory. Very important. Fine. So this is about the theta waves, and this we call it as memory waves. That's it. Memory waves. So whatever I am saying, it must be registered to your brain. That we call it as memory waves, which converts to the short-term memory to long-term memory. Fine. So what is the frequency for this? Yes, it is about 4 to 7 hertz. Fine. And this theta, after theta waves, we will discuss about delta waves. See, delta waves is having a slowest frequency, right? Frequency about how much? 1 to 3 hertz. Fine, 1 to 3 hertz, and it is the slow waves, and because of this reason it is always generated during sleep. So only during sleep we all get this delta waves. Understand? So this is called as major sleep wave. Major sleep wave, and is always seen in NREM. We'll be discussing about that later. Okay, so this is called as NREM. We call it as non-rapid eye movement. It's a type of sleep. Okay, fine. So here, yes, this is about the sleep patterns. Okay, we have different stages about the NREM. We have stage 1, stage 2, and stage 3, stage 4, and then we'll be discussing about REM sleep. So first we'll be discussing about the NREM sleep. Okay, so what is NREM? The non-rapid eye movement sleep. Okay, so in this condition, what is this non-rapid eye movement sleep? Means what? Our eyeball is not moving. Eyeball is not moving. Okay, so only during this sleep our eyeball will not be moving. But in REM sleep, what will happen? Rapid eye movements, which means our eyeball is moving. Finish? Okay. Now in this NREM sleep, we have different stages that we saw in the diagram. Okay, and that we'll be discussing about. Now, first important stage we call it stage 1 or N1. Okay, we have this kind of hertz, that is 4 to 7 hertz. Okay, and this is mainly due to theta waves. Okay, so we have stage 1, which is 4 to 7 hertz, and it's always because of theta waves. Yes, 4 to 7 hertz is how much? Theta waves, right? Now stage 2, it is about 8 to 12 hertz. 8 to 12 hertz. Now just think about 8 to 12 hertz means what? Which wave we have talked about? Is alpha waves. But here alpha wave is not stage 2. Okay, remember, alpha wave is not stage 2. Okay, this you have to remember. But what it contains here? So it mainly contains our sleep spindles as well as K complex. So you can see here sleep spindle and then the K complex here. Very simple. Okay, now let us move on with stage 3 and 4. So it is of a delta wave, which is about 1 to 3 hertz. So these both are delta waves. Okay, and delta waves, slow waves are the major waves for NREM. This is a very important point. Okay, slow waves are the major waves of the NREM, which is a slow wave sleep. Okay, so it is all about NREM, right? And then next we'll be moving on with REM sleep. So here REM sleep means what I told you, rapid eye movement, right? So this rapid eye movement, okay, the impulses always comes from the pons. What I'm coming to say, that the impulses originate from the pons. In pons we are having a body, something called as lateral geniculate bodies, lateral geniculate bodies, and then it moves to the occipital cortex. Okay, so it mainly originates from the pons and then moves to the lateral geniculate body and then to the occipital cortex. And next important thing is that we have a spikes called as PGO spikes. PGO spikes, which is responsible for the eyeball movement. You can ask me why this eyeball is moving. Okay, it is all because of a spike called as PGO spikes. Very simple. Okay, so the important point to discuss is that it mainly originates from the pons and then to the lateral geniculate bodies and then to the occipital cortex. And if you ask me why the eyeball is moving, it's all because of PGO spikes. Very simple. Okay, so next is the 5-mark question about what is the difference between NREM and REM sleep. So most of it we have discussed. For example, the timing of sleep cycle, yes, NREM is going to occur first because of the eyeball there will be no movement of the NREM, eyeball will not be there, and then there will be movement of REM. So it occurs first and then occurs after NREM sleep. So duration normal address is 75% of total sleep. Yes, NREM says 75% of total sleep, and this in REM less, but less, okay, compared to NREM. Then autonomic symptoms, here we are having sympathetic inhibition where there will be low heart rate, low BP and low respiration. But in REM there will be something like normal or something, sometimes there will be high heart rate, BP and respiration. So eyeball movement, we all know there will be no eye movement in the NREM, there will be rapid eye movement occur in the REM. Okay, dreams, yes. So in NREM there will be no memorization of dreams. So if you ask someone what dream you have got, no, I think I have forgotten, because it's all because of the NREM sleep. But in REM sleep the dreams are well memorized. Okay, fine. So muscle tone, it is inhibited in the NREM sleep and is profoundly depressed in case of REM sleep. Now what is the type of sleep you get in REM? It enters into deep sleep, right? Because of this deep sleep the dreams are not getting memorized. Okay, so in REM it's the sleep lightens, that's it. Okay, about EEG waves, there is there is low wave high amplitude, yes or no? In REM, due to the rapid eye movements there will be high frequency and low voltage, that's it. Next, the mechanism, yes, there will be inhibition of RAS and there will be activation of pontine reticular formation, because the origin is from the pons, right? Pons, lateral geniculate bodies and then the occipital cortex. Fine. So here there will be inhibition of RAS. Very simple. Okay. Now let us move on with something very important, that what is the physiological changes occurring during sleep? What is the physiological changes occurring during sleep? Now, if you ask about the physiological changes occurring during sleep, let us segregate between the NREM and then REM sleep. See, NREM sleep, we all know there will be decrease in the BP, decrease in the heart rate, and also decrease in the temperature. Very important, decrease in temperature. And also, if you talk about the respiration rate, yes, there will be slow and also a deep respiration. Slow and deep respiration, that we can see in the NREM sleep. So there will be decrease in the blood pressure, decrease in the heart rate, decrease in the temperature, and also there will be a slow respiration, also a very deep respiration. Now in REM, okay, so REM fall during sleep, the muscles will also undergo something called as atonia. Means what? Out of control, right? Out of control. Yes, sometimes we get a condition of atonia, out of control, which means, but except some muscles don't even get atonia. What are those? One is diaphragm, yes or no? Diaphragm, and also your eye, that is the mainly your extraocular muscles. This is very important muscles. Okay, these two muscles won't go atonia. Other all muscles or out of control, that we call as atonia. Okay, fine. Next important thing is about the physiological changes in the sleep, and then we'll be moving on with hormonal changes during sleep. Hormonal changes during sleep is very simple. Mainly your growth hormone, your prolactin. Okay, and this growth hormone. See, in growth hormone, what happens? The level will be increasing. Yes, only during NREM with stage 3 and 4. Yes, we discussed the different stages in the NREM. Yes, and mainly your growth hormone is going to be increasing during your NREM, that is in stage 3 and stage 4. Your prolactin will be increased during, any idea? Your REM sleep. To be increased during REM sleep. Fine. Now around puberty, what happens is your nocturnal, that is your night time, there will be rise in LH. Luteinizing hormone will be increased. Fine. That is around puberty. And in case of pineal gland, yes, your melatonin will be increased. Okay, which is inducing the sleep. That's it. Fine. It's about the hormonal changes during sleep. Fine. Now let us move on with some important things, that is how there is regulation of sleep. Regulation of sleep. Fine. So in regulation of sleep, we will be discussing about what are the areas and what are the neurotransmitter we can see in regulating the sleep. So first important area that we have discussed in the difference between that is the RAS. What is this? Reticular activating system. Okay, RAS is nothing but the reticular activating system. So what is the neurotransmitter produced? Very simple, that is the norepinephrine. Okay, it is mainly for arousal, right? So norepinephrine is for arousal, right? So the first important area is reticular activating system, which is producing a neurotransmitter that's called as norepinephrine. The next important point is your lateral hypothalamus. Lateral hypothalamus, it is producing a neurotransmitter that we call it as oxytocin. Not oxytocin, orexin. Okay, OREXIN, orexin, or we also call it as hypocretin. Okay, this is also for arousal. Okay, orexin. Okay, so here the individual, so if there is any mutation, in the neurotransmitter, mainly the orexin, the individual will talk to us normally, but in between they go for sleep, right? So the individual will be talking to us normally they'll be talking to us, but in between them they go for sleep, and that we call it as orexin mutation. Okay, and also we call it as narcolepsy. This condition we call it as narcolepsy. The patient is talking to us normally, but in between time the patient will go for sleep, and we call it as narcolepsy, right? Okay, now the third important thing is the posterior hypothalamus, that they mainly produce something called as histamine. That's it. Fine. Okay, so this is all about the regulation of sleep, and then we'll be moving on with a very important thing called as sleep promoting areas. Okay, sleep promoting areas. So in sleep promoting areas, the first important one will be your hypothalamus. A very important thing. So hypothalamus. So in hypothalamus we have a nuclei called as preoptic nucleus. So in preoptic nucleus, also to be specific, we call it as VLPON. PON is what? Preoptic nucleus. VL is nothing but ventrolateral preoptic nucleus. So VLPON. Please remember during the hypothalamus. Okay. So this is because this is all the melatonin inducing sleep. That's it. So in hypothalamus is mainly controlled by VLPON, ventrolateral preoptic nucleus, where the melatonin is inducing the sleep. Next important gland is our pineal gland, we discussed before. Yes, that is responsible for a syndrome called as jet lag syndrome. Okay, no more information about jet lag syndrome, and please type in the comment box. Okay, let me see how much you have remembered about this jet lag syndrome. Okay, so jet lag syndrome is for mainly the pineal gland. Okay, I want some of you to write about the jet lag syndrome in the comment box. Fine. Okay, next we have a cholinergic neuron in region of pons, also in midbrain. Okay, pons as well as in midbrain. So this cholinergic neuron, it mainly releases a thing called as acetylcholine, very important one, acetylcholine, and this acetylcholine is going to induce REM sleep. Very simple. So acetylcholine is going to induce our REM sleep. Fine. Okay. Now let us go on with a very important thing, that is, what are the events occurring during sleep? Let us see about that. What are the events occurring during sleep? That we call it as parasomnias. These are the events occurring during sleep. Now let us segregate them into NREM and then REM. Okay. Now NREM, the first important point, during sleep they tend to walk. Okay. So that we call it as sleepwalking. Okay. That is called as somnambulism. Okay. It is mainly in stage 3 and 4. So sleepwalking, that we call it as somnambulism, that is mainly during stage 3 and stage 4. Okay, fine. The most important thing is, the next thing is, during sleep some people tend to talk. It may be a bad word or good word, anything, and we call it as sleep talking. That's it. Fine. Next one, emotionally deprived children will grind their teeth. Okay, we grind their teeth during sleep. That we call it as sleep bruxism. Bruxism. Okay, and this we call it as teeth grinding. It is seen in stage 2 of NREM sleep. Okay, so in emotionally deprived children, they tend to grind their teeth, and that we call it as sleep bruxism. And bruxism means what? Teeth grinding, and it is seen in the stage 2. Fine. So the next important thing is, children tend to pass urine during sleep, that we call it as sleep urination. Also nocturnal enuresis. Okay, that is sleep urination. Okay, fine. Next important point is, there might be a terrific dreams. Okay, terrific dreams, that we call it as night terrors. That's it. Terrific dreams may occur in NREM sleep. Fine. So we saw many things about during the NREM sleep. Now in REM sleep, okay, there can be terrific dreams. Terrific dreams that we call it as nightmares. Okay. Also narcolepsy we discussed before. Okay, so this is all about the sleep and EEG. Okay, sometimes they can ask you about 5 mark question about the NREM sleep and also EEG. Fine. So thank you. Have a nice day. Thank you.